Hi, Michelle.
Hi.
Yeah, we are going to complete an assessment tool basically known as DHQ, Drug History Questionnaire.
Okay.
It is used to gather information of your history of substance use. It it has question about use of substance in last 12 months and 90 days. It's fine.
Okay.
Yeah, it will plan next different options. If I found using substance in last 90 days, I have to take in a depth about it.
Okay.
Yeah. In the time period of 90 days from yesterday, which is 7 October to 7th July 2023,
Yeah.
and in last 12 months from yesterday, which is 7 October 2022 to 7 October 2023.
Okay.
Yeah, now I will ask about some different substance and you have to answer about that. Is it fine?
Okay.
Yeah. First is alcohol.
Yeah, I had used alcohol in past 30 days.
Okay. And what about cocaine?
No, I hadn't used the cocaine.
Okay. Is any drug like benzodiazepine?
Yeah, I used benzodiazepine recently.
Okay. Any prescription opioids?
About the opioids, yeah, I'm using the prescription opioids from the last 90 days.
Yeah. Okay. Over the counter, you have used any kind of tobacco products?
No, I have used the code. I'm using the codeine, but I'm also using the tobacco products. Actually, I'm a regular smoker, so I use tobacco on the regular basis.
Oh, fine. Any other stimulants like cannabis, which may include weed and grass?
No, I'm not using any other hallucinogens like these.
Okay, like other substance, heroin.
No, not that.
Okay. Or do you think anything else you would like to tell me about,
Yeah,
like the physiotherapy, physioactive drugs?
yeah, I'm using psychoactive drug that is related to my migraine. It has been prescribed by medical practitioners, so that's why I'm using that.
Okay. So now we will take and depth about few substance.
Okay.
Yeah, is you fine to give me answer more?
Yeah, for sure.
Okay. So first of all is alcohol. You have said me that you have take alcohol. How many times in a day from last 90 days?
Okay, so I'm not sure about, but I drink couple of drinks pretty much each night. But my last drink was 2 days ago. I had
Okay,
tried to stay off before coming in, but it wasn't easy for me. I had stopped drinking when I was in the hospital because I was under overdose. So I
okay,
had stopped drinking and at that point. But I think I hadn't drank for 5 days out of the past 90 days.
okay. When did you start alcohol and how long is you remember?
So my first drink was at age of 15. Actually, I had started drinking in my teenage life, and I stopped drinking as soon as I realized that I'm pregnant. So once I was doing party, and after that I realized all this. So from that point, I stopped drinking for some time, for a specific period of time.
Okay. So can you tell me more about the amount and the pattern of different drugs? So is it possible to tell me?
Yeah, firstly, I can go
Yeah.
with alcohol. I'm
Yeah,
taking.
now we will talk about some other drugs and how uses. First is benzodiazepine. How many times in a day from last 90 days you use it?
Benzodiazepine. I don't use it in a particular days. I hadn't used the benzodiazepine in past 90 days. So
Okay,
I am just using it because it has been prescribed by a medical practitioner to me for my problem of anxiety. So I'm
okay,
not using it on the regular basis. it is just taken as a treatment for the anxiety for me.
Yeah. As you already told me about the prescription opioid, uh, can you tell me more how many times in a day or from last 90 days you have using this kind of drug?
Actually, I had said that I am not using benzodiazepine from last 90 days, but particularly if I am using the benzodiazepine and my routine, if I see, then I only take 2 tablets per day, and each tablet is of 1 mg.
Okay. So can you tell me more about prescription opioid?
Prescription opioid, like what about the prescription opioid
Yeah, how
usage?
how many times in a day from last 90 days you are using?
Okay, so it is embarrassing for me, but I took what I thought were passes, and I had an overdose because they were full with a specific kind of drug. So that was a month from where I started prescription opioids, and half a month ago, I think, was the last time when I used the opioids. And I used to get it from my neighborhoods and as well as my friends. So probably I had taken 10 times in past 3 months.
Oh, it's so much. Yeah, as you earlier told me about the tobacco. Yeah, how many times in a day from last 90 days you use tobacco?
So as I had mentioned earlier, that I am a regular smoker, so I use tobacco on the regular basis, and it have been 10 years since I'm using tobacco.
Okay, so that is the all which I have asked you. So this was the assignment tool we just want, so with which we help in further assignments. If you want to tell me more about, you can tell me if you
Uh,
want.
no, that's all for today.
Okay. Thank you, Majel, for coming with me in WebEx meeting.
Okay,
Yeah, thank you.
thank you.